Hello, my name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we're here at RSNA 2014. We have with us now Dr. David Levin. He is chairman emeritus of the radiology department at Thomas Jefferson University Hospitals. Dr. Levin, thanks for being with us today.
My pleasure, Brian.
So we've been talking to folks here at RSNA 2014 about different trends that we're seeing in radiology. What are some important things that you're seeing?
Well, one important trend that I am concerned about, and I think all radiologists should be concerned about, is this new era of price transparency
What does that mean?
that I think is upon us. Well, uh, in past years, patients didn't really think very much about the costs of the imaging studies that they were undergoing. You know, they had a health plan that required them to maybe pay a $15 or $20 copay, and that was it. Now, that was not a big deal for most patients. What's happening now with all of the new high deductible plans that are coming into play, patients now are really starting to shop around. They're really concerned about what the costs are of the MRIs and the CTs that they're going to get and where they might go to get these studies done. I mean, for example, if you look at the deductibles for the plans that are out there, the bronze and the silver plans that are out there now in the under the Affordable Care Act, turns out that the family deductibles, the annual family deductibles for a bronze plan are over $10,000,
Wow.
and for even a silver plan, with a little bit higher level in terms of cost premiums. The deductibles there are over $6,000. So now, when a patient on one of those plans has to have a CT or an MRI or a PET scan or whatever, they are faced with these huge deductibles. So they're going to start shopping around and looking for low-priced facilities where they can go to get those scans.
Do you think
I think what that means is that operators of outpatient imaging centers and even hospitals themselves are going to have to really think about lowering their costs, dropping their charges.
Now, is that possible with all the reimbursement pressure that's happened in radiology? It feels like prices are already pretty rock bottom.
Well, it depends on what you mean by rock bottom. I mean, if if a radiologist is making, let's say, $500,000 a year, and you're talking about decreasing the income of that radiologist down to, let's say, $450,000 or $400,000, I don't think we would find a lot of sympathy in the general population for that kind of a cut. So I think that, if you look at it that way, there is room to drop the costs of these studies.
Do you think facilities are going to be? Do you think they recognize this issue, and do you think they're going to be ready to adapt?
I think some do, yeah. I mean, if you look around on some of the websites now, you can actually find facilities that have dropped their prices substantially, and they're actually advertising the fact that they provide low-cost services in comparison with, let's say, the local hospital or other imaging centers around the area. You can definitely see that. There are websites that are advertising their low-cost services for people who have high-deductible health plans.
Now, another issue in radiology has been the commoditization of radiology. Is this focus on price going to just exacerbate that further?
I don't think so. I mean, I think everybody realizes that we're now in an era of competition. And it's like anything else, you can buy a cheaper car or whatever, but, cars are not looked at as commodities. I mean, they're looked at as brand name products that have certain quality associated with them.
No, where does that leave value in this equation, though? How can radiologists build value? How can they add value to their service when price is so important?
Well, that's a whole nother story. Value, I think, can be provided by radiologists in a whole variety of different ways. I mean, one way that I'm actually going to talk about tomorrow in my annual oration is to behave more like true consulting physicians. Talk to patients, give them access to their reports, be more available to referring physicians for consultation, evaluate requests for imaging studies for appropriateness before going ahead and doing them, being more involved in the performance of the studies with the technologists.
Yeah. But we're asking radiologists to kind of get out of their comfort zone now with the level.
That's right, but I think we are going to have to do that.
Okay, good. All right, well, thank you for being with us.
Okay, my pleasure.
Signing off for AntMini.com, my name is Brian Casey.